Hello, my name is Corey. I'll be doing your cardiac assessment. I'll first get down on the patient's level due to the bed being short. So we get on eye level with the patient. I'll first inspect the patient, look at the general overall appearance, and then first thing I'll do is assess the brachial pulses here bilaterally with my thumbs. I'll then move down to the radial pulses, assessing here the pads of my fingers bilaterally. Move to the right side of the patient, and then I'm going to palpate across all hard areas, starting with the aortic area, second intercostal space, the right sternal border here, the pulmonic area here, the second intercostal space on the left sternal border, moving down, left lower sternal border, the tricuspid area, and then over here is the mitral area. It's the fifth intercostal space, midclavicular line here, also known as the PMI, or point of maximum impulse. From here, I will auscultate all heart fields with the bell and the diaphragm. This is cardiac stethoscope, so it just changes with pressure. Starting in the aortic area here, the pulmonic area here, Erb's point of the third intercostal space, left sternal border here, left lower sternal border, the tricuspid area, and then the mitral area here. From here, I'll ask the patient to lay down, and I will move to her right side. From here, I'll ask her to look to her left so I can auscultate her carotid arteries. First, I'll auscultate the right carotid artery for Bruey's here, and then have her turn her head and auscultate on the left side here. From there, have her look straight forward and palpate the carotid arteries, which is just lateral to the trachea, in between trachea and the sternocleidomastoid muscle here, and then on the other side here. From there, we'll pull out a pen light, small flashlight, and assess jugular venous pressure here. Assess the waveforms. From there, I will palpate across all hard areas as I did with her sitting up, the aortic, pulmonic, left sternal border to the left lower sternal border to the mitral area here. I will then assess for heaves and lifts using the palm of my hand here, the sternum, as well as the PMI here. From there, I will auscultate across all hard areas using the bell and the diaphragm, starting with the aortic and the pulmonic, and then moving to the pulmonic, where you hear S2, moving to Erb's point, moving to the tricuspid area, and then to the mitral area here. And the tricuspid and mitral area is where you can hear S1. And the mitral area is also where you hear S3 and S4 the best. From there, I will assess the rest of the pulses, starting with the femoral pulses bilaterally here, using the pads of my fingers. I will then assess the popliteal pulses here, starting one at a time, using the thumbs to stabilize the patella and using my fingers on the back of the knee. I will then assess the other leg here, doing the same. From there, I will assess the posterior tibial pulses, the medial side of the ankle here, and then assess the dorsalis pedis pulses here. From here, I will then assess the patient for edema. So I'll look at the lower legs as well as the feet, check for pitting, any swelling, as well as inspecting the skin while I do so. And I also will check both the arms, forearms, and hands to check for edema, swelling, as well as checking the skin there. And that concludes cardiac assessment.